Welcome to Medscape. I'm your host, Dr. Andrew Wilner. Today, I have the privilege of speaking with Dr. Jessi Gold. Dr. Gold is Associate Professor of Psychiatry at the University of Tennessee Health Science Center and the author of How Do You Feel? Today, we're going to talk about her book and her role as Chief Wellness Officer at the University of Tennessee. Welcome, Dr. Gold.
Thank you so much for having me.
Well, Dr. Gold, let's start with your book. Why did you write it?
It's not like there was an aha moment precisely, but I've been being a clinician who takes care of healthcare workers as a psychiatrist since the pandemic, if not before, and for the most part have been hearing the same stories over and over again, and then they always end with, but I've never told anyone that before, but no one else feels this way, but I feel alone in this. And for me, a lot of the stories have a lot of the same themes, and we shouldn't feel alone in it. And to me, to be able to tell stories of my patients and tell my own story in a way that might make this information accessible and might make people feel seen was like the ultimate goal there.
Well, I read your book and I found it very interesting. Also, it was quite intimate. There was a lot of self-reveal. How did you feel about that?
I've tiptoed into self-disclosure for a while, been on social media for a while talking about my own therapy, wrote a piece a bit ago about my own meds, and kind of noticed from that the response wasn't that I combusted or that people thought I was a horrible person or judged me for it. And as I've tiptoed into it, I felt more comfortable and recognized the need for it. I also realized in being an expert in an article on burnout that when they asked me how I was feeling and I said, the real answer, and then the article changed to me being the lead story, that clearly we weren't talking about this enough. And so being a person, again, who's like the clinician of healthcare workers, I wanted to model that, and also thought if I could start the conversation, maybe other people would feel more comfortable being vulnerable. So I took the leap to do that.
In your book, you talk about how COVID affected you, and also I believe you had 4 patients and their stories with the different mental health issues that they struggle with. Well, COVID is a little bit behind us. Has anything changed, do you think, in the mental health world?
Yeah, I think in a lot of ways, people want to believe that COVID came down from the clouds, made us sad, and went back to the clouds and we're fine again. And it just never was going to be that way. As healthcare workers, we had high rates of burnout and mental health conditions long before COVID. COVID just gave us new stressors. COVID also really exposed a lot of the issues in healthcare and like access and who gets access to things and people dying and ventilators and, protective equipment, all of these things that were maybe like new stressors or cracks in existing stressors. So it only compounded our sort of bad baseline mental health. And in my experience, like just because it's been better and those stressors are different doesn't mean we're okay now. I think there's a desire to pretend that we're okay now. But for me, I think it's important that this conversation is still happening and that we're not only talking about people who are caregivers, people who work in frontline work in the height of a pandemic, but we also recognize that their jobs are always hard and that their jobs are going to be impacted by those years of their life, and that it should be a conversation we continue to have.
I'm going to read a line from your book. People who ask for help are the subject of gossip and are judged. And what you're talking about there is stigma, particularly for physicians. It's very difficult for them to ask for help. As a wellness officer, what's going on there?
Yeah, there's some data about that. Basically med students, they ask them when they're going into med school, like, is getting mental health help a weakness? And they very small percent of them say yes to that. And then they say, well, what about all this other noise in the culture? What about your supervisors? What about your colleagues? What about residency applications? What about patients? And really over 50% of them, closer to 60 in a lot of those cases, they're saying my patients would judge me, my colleagues would judge me, my supervisors would judge me, and my next level of applications residency programs would judge me. And it ends on this question that's like, well, then if you get help, would you talk about it? And it's a tiny number. And so basically, just because we come in with our own beliefs, and maybe they aren't even stigmatizing, maybe we actually think like mental health is health, once we get into this culture of healthcare, to what we're seeing around us, to what we're seeing modeled, that changes. Maybe we still get help, but we're not talking about it. Or maybe we don't get help, which is obviously the worst outcome. And those folks, we have high rates of suicide in our profession. And the people who show up at my door tend to be quite sick by the time that they show up. It's a little skewed because I am a psychiatrist and not a therapist, but in so many ways, it's like, oh, it's not interfering with my work yet. Oh, it's not interfering with my work yet. A lot of my patients also say, I haven't hurt anyone yet, which has never been my favorite response, because I don't think we should measure our own well-being by whether we made an error or whether we're in a position where patients are going to notice. I think we should care about ourselves to care about ourselves. People come pretty late. And I think that is a product of stigma. It's what we see. I think the stigma comes from what you see modeled. Nobody else is talking about it. I think it comes from even those little jokes that they make about psychiatry or mental health patients. If you see somebody who is in the ER for a mental health thing and the people around you kind of dark humor joke about it, then you say, well, I have that same thing. Like, I'm not going to disclose it. Or, we also have a culture of kind of showing up no matter what, and like using that as a badge of honor, honestly. And I think in so many ways, if we show up when we're basically actively hemorrhaging, like, why would we skip for mental health? Like, it just doesn't meet the criteria for not showing up. And I think all of those things combine to us kind of saying, like, I just have to deal with it myself, or my job is to serve other people, not to serve myself. And so therefore, I just kind of have to ignore what's going on with me.
I know I would feel differently telling my residents, hey, I got to leave early today. I have a dentist appointment at 4 o'clock versus, gee, I got to leave early today. I have to see my therapist.
Do you think you feel at all better than maybe when you started your medical career? Or do you think that it has like been the same for you the whole time?
I think I would be more open today, but I think that probably related to the gray hair and wrinkles I've accumulated.
I think when you have more like power and flexibility, you care less about like what all these other noises are, but I also think, as a culture, we've evolved to being more comfortable with mental health in general. So I think people have become more comfortable talking about it out loud, but in our profession, much less than others. I feel like it's also hard with therapy because if you say that, like, you're probably going every week or every other week, there are only a few things you would need to do that for. So even if you didn't say, I'm leaving at 4 p.m., I have therapy, if you left at 4 p.m. every week for an appointment, it's either physical therapy or mental therapy. And so I think you don't have a lot of options, and residents and med students or, trainees in other health professions don't even have the ability to take that much time off. But if they did and they had to ask for it, it would be a lot harder.
I don't remember wellness officers when I was in medical school.
Oh, yeah.
Is that a new thing?
It's a newer thing. I think it's developed under the concept that having somebody overseeing all of this stuff and valuing it at a higher level is important to making sure things actually get done. Places like Stanford are among the first that actually had chief wellness officers in the hospital system. A lot of hospitals have grown to have them. I'm in a different role in that I'm in over the UT system, the University of Tennessee system, which includes the undergrad schools. So it's a bit different of a role than the people who are just in health. But, the point is to have somebody who's goals and values and things that they're thinking about are always about the well-being of the people that are in the institution, students, faculty, and staff. And that's not always what the bottom line is for everybody else in administrative positions. And so it makes sure some stuff gets done and that you're in the right rooms to make it happen.
Give me an example of one of those things that qualify as stuff.
A lot of what the chief wellness officers who work in hospitals are working on are like, how do we think about the role of the electronic medical record? How do we think about staffing? How do we think about control in your workplace? And what that looks like is like our well-being matching up to what our productivity measures are. Are we actually measuring the right thing? You see a lot of the system focus from the chief wellness officers that are in the healthcare system. I have a little bit different bent just because I'm not exclusively in the healthcare system. So a lot of what I'm looking at is like, why do we focus so much on the intervention side? And are there enough things that we could be looking at? And what kind of options would we have for prevention on our campuses? Because, it's always going to be stopping the bleed that is what's going to take your attention, right? If there's a crisis, you have to address the crisis, but we don't all need to get to the crisis. So when you have a little bit of breathing room and time to step back and actually look at what's going on, how do we make sure that we have preventive options, that we have things for folks to try to do along the way that isn't just like, oh, they got to crisis again, and that's what I'm looking at. Like, what does that look like? Is that a peer support program, a coaching program? Is that just making sure that they know of all the resources and where to access them when they need them? Is it regular screening tools for themselves that they can kind of monitor? There are lots of things that people have implemented, but across the spectrum, across our whole state, really, for me, we're kind of looking at what makes sense and what programs are working or not.
Well, we're just about out of time. I have one more question.
Sure.
Apart from seeing you, do you have any advice for physicians and other healthcare workers trying to improve their own wellness?
Yeah. We're people that do this job, not robots that do this job. So pretending that our job doesn't affect us doesn't help, because it should. It's a hard job. We listen to hard stuff. We see hard stuff. Pretending that somehow like you can see all that stuff and hear all of that and be fine doesn't make sense. So instead, you should think about how you can deal with that and approach it that way. I'm not saying that the healthcare system is great, because there are so many problems in the system. But if you'd like to stay in it for as long as you have, or you'd like to stay in it at least for a while, you do have to figure out what it looks like for you to do that. And, for me, it's been things like actually checking in on myself and my feelings, making sure I take my vacation days, working on self-compassion and that like mean voice in my head when I do things wrong or when I think I did things wrong, looking at how email takes over your life and making really strict boundaries around certain things like talks or all those extra asks that come up in academics. There are ways that we can manage it. And it isn't to say this is somehow a resiliency problem, because our resilience is higher than any other field. But it is to say that like we can do something. And I think that's more important than doing nothing.
Dr. Gold, thanks for joining me for this Medscape interview.
Thanks for having me.
I'm Dr. Andrew Wilner. Thanks for watching.